There. It's Joe Covell with doitformeinsurance.com. You should be able to see that in the bottom of the screen there. In the top left corner there, you see a flyer for our weekly event that we just got home from. So that's going to be at the Quakertown Farmers Market every weekend from now until December 15th, the end of Obamacare open enrollment. But we're also there for Medicare. That's why we're starting before November 1st to help people with their Medicare needs and to go over some changes to Obamacare. Just wait till the last minute to release those rates. But event here today, just wanted to do some Medicare basics since it is open enrollment for Medicare Advantage and for prescription Part D plan. So from now until December 7th, Medicare beneficiaries are able to change their Medicare Advantage Part D prescription plan or buy one if they haven't yet, or if they've had original Medicare and been supplementing it and maybe that's gotten a little too costly for them. They are able to go to an Advantage plan now. So, I'm just going to do some basics, a couple slides here. This is a presentation we've been given, myself and my significant other and partner, Robin Bartow, custom benefit plans and Do It For Me Insurance, and also direct benefit advisors. So Medicare basics, understanding the basics of Medicare. Well, we have two parts of Medicare, right? A and our B. Our Part A comes free if we've worked the equivalent of 40 quarters or roughly 10 years of Medicare eligible work experience. We do get our Part A, or if we're new to the country, then this part can usually be around $470 if you haven't worked the 40 quarters. So for most people, that's free. And also people that are on Social Security disability usually have to wait maybe a period of 18 months. So Part A is hospital services. Part B is the part that comes out of the Social Security check. It's typically $134. But it can go up or down based on income. A is your hospital services, B are your doctor-related services. Those two, 80% of your total cost for Medicare. This is what's known as original Medicare. If you had nothing more than this, this is 80% of your cost. So we have two different kinds of options we can do to cover that 20%, those things that Medicare don't cover. So A and B do not cover any prescription. So in order to be compliant in terms of Medicare, if you're not currently still working or don't have any adequate coverage like VA coverage or TRICARE, you are required to sign up for B. You have a period of usually 2 to 3 months to do so. After that, you can get fined for not having your Part B. And also, if you don't have a prescription plan, a lot of times 65-year-olds today are in pretty good health. They think, well, I don't have prescription, so why do I need to take a prescription plan? Because you actually get fined per day that you don't have it. And you won't even notice the fine until you go to buy a prescription plan or a Medicare Advantage plan that has prescription drug benefits in it. Often the case there. So we have two different options that we can do when it comes to the 20% exposure. We have A and B plus a Part D. Of course, meet everything we need to meet. Obviously, we're on the hook for 20%, and it's surprising how many people actually just pay 20% of the cost of everything. Never really was explained to Medicare supplements. So Medicare supplements, and there's three usual types. There's F, there's G, and there's N. Designed to cover the 20% that Medicare is not covered. That's option one, is keeping original Medicare and supplementing. Option two is a replacement, where you're replacing Part A and B with Medicare Advantage. Now, you never get out of paying this Part B premium, the $134. That's going to be with you even if you are replacing it with Medicare Advantage. But it's never really gone. It can always come back. You can always get it back. There's a disenrollment period in the beginning of the year in which you're able to disenroll from Advantage if you did not mean to do it. The problem with disenrolling is, with a Medicare supplement, you can really only get that guaranteed issue, meaning no health questions asked. That option is only really ever available to you within the first 5 months of either turning 65 or activating your Part B if you've been delaying that because you work for a big company. Other than that, they ask health questions. With Medicare Advantage, they never asked health questions. You can get that anytime. The price is the same regardless of age, and zero premiums you see out there. So that's the Medicare Advantage. It's always an option. Usually when we're consulting somebody who's turning 65, we advise that they try the original Medicare route first if they're able to afford it, because Advantage is always an option that they can do later on should the supplement get too unaffordable, because they really only have this guaranteed time here to get it without any health questions asked at the rate advertised. And Medigap versus Advantage supplement, you're looking at probably a total cost of around $200 a month for a 65-year-old. Medicare Advantage are those zero premium. With original Medicare and a supplement, you can go anywhere that accepts Medicare. It's going to be, you don't have to really look at your doctors. With Advantage, you're going back to those networks you're used to, HMO, PPOs. You have a network of doctors, although a lot of things these days are PPOs that I have Robin talk to you about. Again, this is her contact information. Or just go to doitformeinsurance.com. With the Medicare supplements, you don't tend to get a lot of extra benefits in terms of hearing, vision coverage built into the Medicare Advantage plans, and it's getting better and better. So more about Part D. Helps to pay for outpatient prescription drugs. People with A and B are eligible, obviously. It is voluntary, but it is required because you will get penalized if you don't have prescription coverage, such as through an employer or through the VA, TRICARE, or if you're part of a union, or obviously you're on a group plan. The major issues with prescriptions is that thing called the donut hole, and it's either a terminology you vaguely know or you're soon discovering it. So basically, in a nutshell, there's 4 parts to any Part D standalone prescription plan and also the prescription elements of Medicare Advantage. You first start out in your deductible phase, if there is a deductible. Typical deductibles around maybe like $415 or so. And usually on most plans, Tier 1 and Tier 2 generics are excluded from the deductible, so you do get first dollar co-pays on that before meeting the deductible. After you get out of that deductible, you're in your initial coverage phase, or those two actually kind of work hand in hand, or even some of the better plans don't have deductibles. So your initial coverage phase is where everything just starts out with a copay. We've got a 5-tier schedule. Tier 1 and 2 are your generics, and then you get into your brand, preferred and non-preferred, and then specialty drugs. So yeah, there's a lot of drugs that gets expensive, but basically when the total spending becomes $38.20 a year, that's when you enter the donut hole. And in the donut hole is where you go into paying a percentage until you reach $5,100. So, you start out the year, everything's a relatively low copay. All of a sudden, that $300 cream in the donut hole, after you reach that $38.20, that $300 cream, you're paying 51% of the cost. But the one thing that's nice about this year, by 2020, the donut hole is supposed to be phased out, and 2019, they're actually going to be limiting the co-insurance amount on brand drugs. So instead of 50%, now you're only going to be at 25% and 37% for generics. And again, that's supposed to be phased out by 2020, but we'll get into that later. And then after you reach that 5,100, you go into your catastrophic phase where you go to paying very low copays. So that's where a lot of seniors and those on Medicare, they run into problems, is in the donut hole. All of a sudden the drugs start costing a lot of money. So keep in mind, especially if you're looking at retiring, you just turned 65 and you're still working. A lot of group plans have union, you've had specific copays for your drugs, brand, generic, just a straight dollar copay. Now you're dealing with tiers, you're dealing with the donut hole. So being asked if someone should stay on their work coverage or if they should go on to private Medicare options, Advantage, or supplements, I always say, well, you got to look at your prescription usage, because a lot of times those prescriptions are covered on that group plan. If you haven't activated your Part B, you can delay it if you work for a company of 20 or above. If you're under a smaller company, you usually have to take your B. It just has to do with which one is primary, the plan or Medicare. So with the larger companies over 20, you usually can delay your B when you turn 65. And a lot of times seniors do because of the prescription coverage. Let's talk about what's new for 2019. Earlier we discussed about how you can disenroll from a Medicare Advantage plan. Normally during that disenrollment period, which used to be from January till around Valentine's Day, if you wrongfully picked a Medicare Advantage plan, you used to be able to disenroll from Advantage and go back to original Medicare. Now keep in mind with the supplements, if you've given up a supplement to go to Advantage, I talked about how there are health questions asked. So just because you disenroll from an Advantage plan, you're able to get your Part D prescription plan without problems during that time. But unless you're in good health, most supplements you're not going to qualify for. You're going to be on the hook for the 20%. So, but what's nice about this year is from January 1st till March 31st, you'll actually have the option to change your Medicare Advantage plan once per cycle here. So finally, if you make the wrong decision, or you caught it early that the doctor went out of network, whatever it may be, you picked the wrong plan, now you'll be given this time period to switch Medicare Advantage plan or disenroll, back into D and original Medicare. Over-the-counter drug allowances. And this is usually in what we call dual SNP plans. So a dual SNP S&P special needs type plan is someone who's on Medicare and Medicaid. So those are special needs type plans because usually Medicare and Medicaid will cover what the other ones don't, but limited to a doctor that accepts Medicaid. With a S&P plan, it's an advantage. It's usually an HMO. So that gives you a network, whereas otherwise you just had to hope that the doctor accepted Medicaid. Over-the-counter drug allowances have been something that have been in those special need plans for quite some time, and now it's kind of making its way Medicare Advantage market. So some have some really nice per month over-the-counter allowances. We're talking about Advil. A lot of drugs these days are becoming over-the-counter, such as Flonase. They're all building in. It's either a quarterly or a monthly allowance, and you have to watch how you can go about ordering that. So there's no longer a therapy cap. Beneficiaries will no longer have to pay the full cost for outpatient physical, speech, or occupational therapy. So just, making those Advantage plans more appealing. Medicare booklet put out there by CMS. They've actually made some really cool updates. You're getting some new updated information. And also the Plan Finder, medicare.gov/find a plan, which is a fantastic tool that allows you to analyze your prescription costs. You can put in all your prescriptions, the dosages, how often you use it, and it's going to recommend the best plan for you, either standalone Part D prescription plan or a Medicare Advantage with prescription drug coverage. An increase in telemedicine for anybody that follows Teladoc's stock, that's constantly climbing there, although the future is telemedicine. Soon you'll just be able to take a picture of your tonsils and send that to your doctor, and they'll call in a prescription for amoxicillin. As of January coming, 2019, Medicare Advantage or MA plans will be able to cover meals delivered to your home, home delivery after a hospital stay, transportation to and from your doctors, and also home safety features such as bathroom grab bars and wheelchair ramps. To get those covered by the insurance plan, a medical provider must recommend in order to be covered. In-home help. Medicare Advantage plans will have the option to pay for help from home health aides, the activities of daily living, dressing, eating, and personal care. A broader definition of the requirement that Medicare services to be primarily health-related. Test drive that plan, as we talked about. Now you get a little more leniency if you pick the wrong plan. From January 1st to the March 31st, you'll be able to change your Medicare plan Advantage option or go back to original Medicare. So the 21st Century Cures Act. What is MACRA? Medicare Access and Chip Reauthorization Act of 2015. There's a lot involved in this. We're not going to get into all of it. We're just going to review some basics and why you should care about it. The Medicare Provider Reimbursement Schedule, which is based on a fee-for-service model. This is why everybody is getting new Social Security cards. Your Medicare number was your Social Security plus a letter, Social Security number plus a letter. Taking that socials off of the Medicare cards and giving everybody a unique new ID. January 1st of 2020, the Part B deductible can no longer be covered by Medicare supplements. So that is why the F has to be phased out. Anybody that has an F, you will be able to keep it. It will be grandfathered. You can also, if you're in good health and can pass the health questions known as underwriting, then you can switch to another carrier, but you won't be having new risks coming into the pool. And what is still not known by many of the carriers that I asked, nobody knows if there will be a guaranteed issue period. Move supplements very easily. There are some special circumstances, such as if you move to a new service area or the plan ceased to exist. So what's not known is if carriers are going to allow for a guaranteed issue period, so someone from a plan F can go into something else like a G or an N. That's what's really not known there. So the thing to keep in mind for those looking at buying a Plan F is really give some consideration to G and even N. Without young, healthy individuals coming into the risk pool, the Plan F, I can only imagine it's going to get higher and higher as time goes on. So definitely give some thought to that. So if any questions, we're here for you. Just check us out, doitformeinsurance.com. We're a subsidiary of Custom Benefit Plans, and we also work with direct benefit advisors. So thank you so much for your time. And